Okay. Assalamu alaikum wa rahmatullahi wa barakatuh. May God's peace, mercy, and blessings be upon you all. My name is Sabina Moyuddin. I am the Executive Director of the American Muslim Advisory Council, and we work to empower the Muslim community across Tennessee. And one of the ways we want to empower our community is to make sure our community has accurate information on COVID and COVID vaccines. So I am delighted to have with us Dr. Alex Jahangir, who is the chair of Nashville's COVID-19 Task Force and chair of the Metro Nashville Board of Health. And in his free time, he's an orthopedic trauma surgeon at Vanderbilt Medical Center. So thank you so much for joining us.
Truly my pleasure. Thank you for having me.
And also we have Dr. Ahmed Abu-Halimah. He's chair of AMAC's Middle Tennessee Muslim physician, who have been helping us by giving the community some of the needed information on how to stay safe with COVID and encouraging community to get vaccinated. He's also chairman of the board of directors for Islamic Center of Murfreesboro, and he is a cardiologist with Vanderbilt Medical Center. So thank you so much, Dr. Abu-Halimah, for joining us.
Thank you, Sister Sabina. Jazakumullah khairan for putting this together. And Alex, thank you for joining us. We're going to be depending heavily on you, as the great says we cannot make fatwa when Malik is in Medina. So Alex is definitely our Malik tonight. So.
Oh, well, no, you're too kind to even say that, but no. But thank you for having me. I look forward to this discussion.
So, let's just jump in. What is the state of COVID in Nashville and Tennessee? Give us some of the grim statistics.
Sure. Well, I wish we had this conversation in July, because we had really hit a point in July where I really felt optimistic that we had this behind us. So I will start in Nashville, but I know our audience is broader, and so I'll extend the numbers a little bit. So I just got my most recent update, and as of a few minutes ago, the number of cases in Nashville is 113,537 people have had COVID totally. Mm-hmm. So that's more than one. That's about 1 in every 6.5 Nashvillians have had COVID during this time. Currently, we have 5,735 people actively infected. To put that in perspective, our highest we ever reached, so we have 5,735 now, but at the end of December, we were nearly at least at 7,400. So we're unfortunately revving back up to that number. At the beginning of July, so I was telling you, July would have been great if I'd come on, we only had 444 active cases. So we really have, from the beginning of July to now, have gone up about 1.25%. So really not great. The state of Tennessee also has been seeing the increase in cases. We just crossed 1 millionth Tennessean that become infected, and in the United States, 38.8 million people have been infected. So this disease, unfortunately, has really taken its toll. One thing that we need to look at is our death rate as well. And in Nashville, 984 people have died, which obviously every death is tragic. And in Tennessee, we also just hit the milestone of over 13,000 Tennesseans have died from this disease. So 13,241. And in the United States, 637,000 people have died. So this is if that stopped just there, it would be really grim news, and it is grim news. But here's the upside. Vaccinations are picking up. In Nashville, we now have 58% of all Nashvillians who received at least one vaccine. Almost 52% have been fully vaccinated. If you take out the kids, that means 58% of eligible Nashvillians have vaccinated. State of Tennessee needs to do a little better. Only 49%. So our national numbers are consistent with the national average. Tennessee numbers, however, about 10 points lower at 49% with one shot, 41% fully vaccinated. So this is why I hope, as we start this dialogue I will keep coming back to this important fact. Vaccines are critical, and we need to do better in Tennessee to get our numbers to a point that we can save lives and be able to go back to things that we enjoy doing and being with friends and family and worship together. These are all super important things that I hope we can talk about as we go on.
Yeah, it's interesting when you look at the maps across the country on where the highest rates of COVID are. Tennessee is up there, and it's not a distinction we want to have, right? But those vaccination rates for the state of Tennessee are better than, say, a few months ago. So there is some room for hope, some improvement, but we still have a ways to go. I don't think this summer, like we even imagined that here it is, end of August, that we would be in this position. And so tell us a little bit about the Delta variant and like, why has this kind of changed things? What, how did this wreak havoc in our community?
Sure. So when we, the first case of COVID in Tennessee arrived, I think, March 6th to 2020. So to put it in perspective, when that first variant first original virus came to Tennessee, every person who was infected had the ability to infect 2 other people. With time and with more and more people being infected, what viruses want to do is just reproduce further, right? Viruses just want to spread. So as we started, we as people started creating ways to keep people from dying, or vaccines, viruses found ways to mutate so they can spread. So the Delta variant, which has really, the Delta variant is the same variant which, if you remember, in India in the summer was really making just havoc on India. That is the virus that's now here. The reason this virus is so rampant is, as I said, the original virus, if I got it, I'd spread it to the 2 of you. This virus, if I get it, I spread it to 6 other people. It's that much more easily transmissible. And it's a lot more easily spread amongst children. And so because of that, this virus is so much easier to spread. Additionally, I think all of us have such a level of fatigue, right? Of doing all the things we've done from the beginning of this. So social distancing, wearing masks. So I think all of us, myself included, have lowered our guard some. So by us lowering our guards and having a more transmissible virus, a virus that some say is as transmissible as the measles, which fortunately many of us didn't have to deal with, that is why you're seeing such a wildfire of infection now. Add on to that the fact that almost half our population is not vaccinated, including all of our children, right? And so for me, my biggest concern is our children right now, because I don't want to, obviously we don't want our children to be harmed, and they don't have a choice of whether to get a vaccine or not. And the best way to protect them is to ensure as much people around them are vaccinated. And that's why I am such an advocate of making sure as many people are vaccinated as possible.
Yeah, I think that has been one point of contention with the governor and with the original COVID virus. We saw that it wasn't really spreading much with children, but now things have changed, hasn't it?
It has changed. I recently saw 36% of all cases in Tennessee are in children under 17. Here in Nashville, to put it in perspective, if you look at the age range 0 to 17, so essentially everyone under 18, and yes, some of those people are vaccinated. The first 17 months of this virus, the population 0 to 17 accounted for 11% of all cases. In this past 30 days, 21% of cases are in this age range. So wow. It does spread in kids. Again, I have to preface and fortunately say children, for the most part, aren't superly impacted in the short term, right? So while there are kids that get super sick and there's a syndrome that results from inflammation that causes kids to get sick, majority of kids are fortunately not extremely ill. What I worry about it's two things. First of all, those kids going around other kids and spreading it.
Mhm.
And some of those kids may have some medical reason that makes them more susceptible. But those kids infecting other people around them, adults who may not be vaccinated, or what we don't know, and I think it's hard for anyone to claim they do know, is what are the long-term implications of a child that gets COVID? Hopefully it's nothing, but
Yeah.
I think we don't know. So I think the best course of action is to mitigate the risk of children getting infected, so we don't have to find out what those long-term issues are.
And then the misfortune of the Delta variant coming at a time when school was starting. And I know as a parent, and the children were eager to get back to in-person learning. And it just in the past couple of days, a number of rural county school districts have had to say they're going to be closed for the next week. And so, it was just an unfortunate mix of circumstances going in for our children.
There are, but here's the things I want to share with your viewers and children. I have 3 children, all in elementary school, right? So I feel this firsthand. Please know that. But the difference between now and March for children is this. In March of 2020, gosh, it's been over a year now, so that's a clerical year. In March of 2020, there really was no guidance out there from national organizations. The science is really hit or miss. There is now guidance from the CDC about how we can deal with children. And I think all of us agree that children in person is probably best, right? I mean, I know how hard it is to teach kids at home. The interactions kids need is super important. And the CDC has clear guidelines of how you could allow that to be successful. And it's very easy. It's people who are unvaccinated. Now the CDC says everyone in school should wear a mask. If there's a couple of reasons for that. First of all, wearing a mask does lower the risk of passing the virus on and getting it. But also, if your kid has a mask on and a classmate of your child tests positive and they've been wearing a mask 3 feet away, there's no reason to keep your kid out of school. There's no reason for your kid to have to quarantine. Very different than where we were 18 months ago, where if you're in a classroom with a kid that's positive, shut the whole classroom down. Again, the best way to be safe around that, and what the CDC says, is 3 feet, wearing a mask. Your kid can continue being in school. So there are ways to protect your kid, and I think that's the safest one until a vaccine comes out for them.
Yeah, I think I've seen it firsthand at my son's high school that there were some cases of COVID, but it wasn't that everyone had to go and quarantine, because you have so many kids who are vaccinated. They were wearing their masks. So it's about following some basic rules, right? And keeping to them. So,
that's right.
So let's talk about
If
herd
I may add
immunity.
something,
Yeah,
Sister
sure.
Sabrina, to what Alex was saying, especially about the Delta variant, as he said that, if the previous variants would spread from 1 to 2, this one spread to 6. Also, people need to understand that this variant can be way more aggressive and cause more severe illness in patients, unvaccinated patients. So that's another reason for people to start thinking seriously about getting vaccinated. And I think it's our duty also as physicians and to spread the word more aggressively and use the power we have as a physician in a positive way when you talk to your patient saying, I'm vaccinated, or I got COVID, or I encourage you definitely to get vaccinated, because I think it has a great impact. Of course, you're going to have the resistant ones, and they're going to tell you that the COVID has fetuses and parts of fetuses from frozen fetuses from the 1960s and all of that nonsense. But again, the data is there, the resources are there. So it's our duty to tell them about this, and especially with this variant that's been seen here, unfortunately.
I think that's such an important point, because when COVID first hit, there were a lot of cases in our communities. And so there are people who will say, well, yeah, I've had it before, it wasn't so bad. Or, or they saw a friend or a relative have it and say they got over it. But this is different now than a year ago. And
It's way different, way more aggressive, to be honest with you. And
Yeah,
and if you had COVID before, if you have even for vaccinated people before, the previous variants that if you are vaccinated, you might not feel it, you might get just a very, very simple symptoms. But the Delta variant, you might get sick.
yeah, and I think one thing I've seen, there's a couple. You bring up some great points. If I may jump on your statements here, people are dying, right? Yes, I would say if you look at our hospitals, 90% or greater of hospitalizations are people who are unvaccinated. The people that are vaccinated or in the hospitals are typically much older people and people with medical comorbidities. Additionally, if you look at people dying, almost, not all of them, but a super high majority in the upper 90s are people who have been unvaccinated, right? I just, unfortunately, like I mentioned right before this conference, I received a report, and in the report that came out of about 5 or 6 tonight, one of the people who died is 42 years old with comorbidities and no COVID vaccinations. I mean, 42, right? I mean, that's younger than me, and that really hits home. And so I think what is important with Delta, as the doctor said, is you are starting to see what we call breakthrough cases, right? So I've had being in the role I'm in, it's really interesting because I've been very fortunate and blessed to meet a lot of people, and anytime any of them have a COVID issue, I get a call about it, right? And I've had probably 10 friends in the past few weeks that have had what we call breakthrough cases. So they've been fully vaccinated and they get sick. But when they get sick, typically the symptoms are nothing like the people who I know who have this variant who are unvaccinated. Mm-hmm. They usually have cold-like symptoms. Maybe they lose taste or smell for a day or two, but that comes back. And almost none of them require any kind of medical care. They just it's like a bad cold. They go and they drink some water, make sure their oxygenation is good. And so I don't want that to be a discouraging factor for people to get vaccinated. And I'm so glad you brought up some of the misconceptions around the vaccine. For example, there was some claim that the Johnson & Johnson vaccine had fetal products in it. It does not, not at all. And that's such an important thing to highlight, because I get that obviously that's a deterrent for some people not to get it. I can respect that. The FDA has now fully approved the Pfizer vaccine. The Moderna vaccine is coming out, hopefully with the same authorization soon. But these are not. So another thing is, oh my gosh, look how quickly these vaccines came out. Mm-hmm. I think it's important to recognize that these vaccines, which they're the mRNA type vaccines, so they're new to us in a certain way, but these are vaccines that have been studied for this technology has been studied for 10, 15 years. It's a vaccine they use for Ebola vaccine development and other vaccine development, been used for a long time. And part of the reason why we were able to have such a successful rollout is it's really amazing what happens when you when everyone's brilliance is focused on one problem, and all the money in the world literally is focused on one problem, and most of the regulatory red tape is focused on one problem. Before these vaccines ever hit the market, in the United States alone, 30 to 40,000 people trialed the Pfizer, 40,000 trialed the Moderna, and then 60,000 in the US alone trialed the Johnson & Johnson before they even came to market. And now they've come to market and you have millions and millions of people. So when it comes to safety, I think that's something I want to highlight too. I realized on Facebook Live, and people may not have realized, I put something in the chat box here. There's a great website called getvaccineanswers.org. Getvaccineanswers.org. It's a site sponsored by the Ad Council, so national organization that just gives information, right? Takes out all the hype, looks at credible information. And then there's a site, vaccines.gov, which literally you go in, you put your zip code, and you can even choose what vaccine you want, and they'll tell you what all options are around you. So two great resources for anyone, whether you're in Tennessee or beyond.
No, that's great to know. And you brought up such a lot of important points, because you hear from the community, some people who are hesitant with taking the vaccine is it came out too fast. We don't really know what this, long-term side effects are, but, Pfizer just got full FDA approval, and we're, Moderna and Johnson & Johnson should follow suit. So there's, and just the very fact that millions of people have gotten vaccinated, there's your, there's where you get all your data from. So I think that's a lot of times people think, well, this data is still not years in the making. And does vaccines stay in your body, a year out?
Well, this is what we're all discovering now, right? I think anyone that claims they know what will happen 4 years from now or 5 years from now is frankly probably misinformed or not being transparent. From the very beginning, we didn't know what we were going to see, but what we are starting to see, and you see this in data and recommendations being put out now. I was one, and I suspect you as well, doctor, were one of the first people that got vaccinated in this area. My last dose, so I got vaccinated on December 18th, something like that. And my second shot was on January 8th.
So I had the same thing like you. It was December, because December 18th was the first day that we all physicians start getting vaccinated.
And I bring that up to say this: we were the first in this region, if not in the country, frankly. Mm-hmm. There was a group of 30 to 50,000 people, or if you look at both trials before that, a few months ahead of us. So what this companies and scientists are doing now are following their antibody levels, right? And what I think they're starting to see, and what we're seeing clinically, is we're starting to see, as I mentioned, an increase in breakthrough cases. I think the antibody levels are probably dropping, and you're getting more people get infected, although not severely as sick. And so the recommendation that starting tomorrow, in fact, the committee that makes these recommendations for the federal government is meeting, like literally tomorrow morning, I believe, or afternoon. So you'll see a news sometime tomorrow. And the recommendation, I suspect, will be that at your 8-month mark, you should get a third shot. Okay, so unless so for most of us, that's early September, although I think they should put a date of September 20th to start it. But pay attention. But if you are immune compromised, so let's say you're on a chronic steroid, or you're on methotrexate, or you've had a transplant, or there's other reasons, you've had cancer. My gosh, the biggest one. Yeah, immunotherapy. You qualify for a third shot now. Please don't delay, right? If you've already invested in getting your first 2 shots and you meet that criteria, please get your shot now, because heaven forbid you get sick. You're the person who's going to have the not great outcome. So please be aware of that. If you got Pfizer, they recommend you get Pfizer. If you get Moderna, they recommend you get Moderna. Johnson & Johnson has not had recommendations, but again, Moderna and Pfizer have been out for the 8 months roughly. And so be aware that tomorrow, though, there probably will, or maybe the next day, I don't know when they'll break the news, but there'll be the meetings tomorrow. There will probably be a formal recommendation for everyone to get a booster shot at the 8-month mark, or maybe even sooner. There's some discussion today that may be sooner, but we'll know tomorrow. So I don't know. Yes. That's a long answer to your question of will it be in the body forever. If some of you remember getting a hepatitis B shot, there was 3 shots you got, right? You got one, and a few months later you got another one, and a little bit longer you got another one, and now you no longer need hepatitis B shots. Maybe this will become something like that. I don't know. I'm not going to take that I know, but please follow the recommendations, because it's the best way to stay healthy.
And I know that
the point, Sister Sabina, of what Alex was saying also about the third shot, because even I want to use the word for the immunocompromised patients that we did not even call it a booster shot for the immunocompromised patients. We just call it a third shot, because their immunity is not the best compared for the non-immunocompromised ones. So definitely, if you are immunocompromised, and if you have, and there is a whole list of things that you can look at CDC website that will tell you who's, what qualifies as immunocompromised. Definitely, like Alex was saying, please get that. Alex, Sister Sabina knows, and some of the attendants, they know. So as I said, like you, I had that December 18th, my first Pfizer dose, and first week of January, I had the second dose. And what happened in July, I traveled overseas. I went for a 2 weeks vacation. I went to Turkey and to Jordan, and I was there in Turkey for 6 days. And that's almost now 6 months after my second dose of vaccine. I was in Turkey for 6 days. The day I arrived to Jordan, I was having symptoms and I had COVID. So I did not feel good. I was for 3 days, I was sick with fever and cough and congestion. And day number 6, I lost my taste and smell. Again, I was treated at home, alhamdulillah, thank God. So the vaccine did what the vaccine was supposed to do, although it's been 6 months since my second dose, which means my antibodies were lower. And it made sense. Vaccine did not protect me from having COVID, but it did protect me and my wife and 3 out of my 4 sons from being in the hospital. 2 of my sons are 10 and 9. They were not vaccinated because they had no choice. We could not vaccinate them. They're less than 12. So we had the COVID, and as I mentioned, that Delta variant is aggressive, but alhamdulillah, I did not require hospitalization, did not require any oxygen therapy. Yes, I was treated aggressively at home, but again, it's an example of why you should have the vaccine, so you don't get sick enough to be in the hospital. It's an example of why you should have the third or a booster dose, whether you are immunocompromised or not, because I am waiting for September 20th to get it.
Well, we're very grateful that you came home safely after that harrowing experience overseas, because not being at home and being that sick is not a
it's not fun. Yeah.
It's not fun. So and I just wanted to say that in Nashville, all the Metro Health Department vaccination clinics, they'll give you a booster shot if you qualify, if you're in that immunocompromised category. And then I want to make sure I cover everything. The question about the vaccines is two things. Like, first of all, how many people need to be vaccinated before we get herd immunity?
Yeah, so I think that question on herd immunity is I hate to say a lost one, but it's a lost one now, right? Early with the original COVID vaccine, SARS-V2 vaccine, the thought was around 70%. Now, again, if you remember at the very beginning, this one person infected 2 at the time. Mm-hmm. Now, given that it's highly transmissible as this is, 1 affects 6, some now are raising that number to 90%, similar to measles. But here's so I would, while of course I would love to see 90% of our society vaccinated, that's less likely, right? So I think we need to think about ourselves. Can I actually hop on one thing that around testing? So if you're vaccinated now, I think it's really important to know if you're vaccinated and you start having symptoms as described, like shortness of breath, congestion, fever, and especially if you had your vaccine 6 months or later, or 6 months or sooner, excuse me. There's lots of testing options now as well. And while I can't speak to what the state of Tennessee is doing for testing, and I think I saw somebody have something. Yeah, actually, there's a COVID testing here at Tennessee.gov. I'll let you repeat that. The city of Nashville has actually taken the burden of a lot of our regional area, right? So over 20-something% of our people are getting tested now, and our city sites are from outside the region. But here's some testing options for you, and I think this is important information. We have a location off Murfreesboro Road. I believe it's 2092 Murfreesboro Road.
2491 Murfreesboro.
2491. Thank you. I was totally off. I knew we had the 2 right. 2491 Murfreesboro Road. It's an old Kmart location. That location is open from 7 to 1, 5 days a week. That location is free. You don't have to provide really minimal information. So you just go. There's a lab who I speak with regularly. We have 24 or 40-hour turnover. We've expanded that capacity of that lab that testing site by 4x. So now this past week we did over 4,000 tests there. In addition to that, almost every one of our vaccination events run by Metro Health has testing capacity there as well. Maybe as early as tomorrow, we're going to announce a second site. There you go. There's some breaking news for you, but hopefully as early as tomorrow, we'll announce another full-time drive-through site similar to what we had earlier, somewhere else in town. So we'll have another drive-through. The medical centers, Vanderbilt has opened their 100 Oaks location 7 days a week for testing. So there's testing. So testing is still important to know if you have symptoms. And the reason it's important is it's more and more, even if you're fully vaccinated and you're positive, you could be potentially spreading. So if you have young kids, maybe you act funny, but here's another reason that you vaccinated. Let's say I am fully vaccinated. We don't need to hypothetical that. If I come across somebody who is positive and they interact with me, I don't have to self-isolate at home, right? I can go on with my life. Assuming I don't have symptoms. You get tested about 5 days in just to confirm that you're good, but you can do your life and work and go to school. And these are reasons why it's so important to get vaccinated. But there are testing options, so you should get tested. Those capacity will continue to increase, and just know that we as Metro Health have not forgotten that responsibility, especially as maybe it's less easy to do it across the region now.
Yeah, that's what. Yeah, go ahead.
So if I just want to add to the points that Dr. Jahangir is saying here, especially if you are fully vaccinated, because there is a lot of also questions people ask the unvaccinated ones, why would I get vaccinated? Since I can get the COVID. Well, the vaccine never claimed that it was going to protect you 100% from getting the COVID, but it will protect you almost 100% from dying and more than 95% from getting really sick to be in the hospital. And that's proven by the data the vaccine showed and by the data we're seeing right now with the patients in the hospital. Mm-hmm. Now, the other important things, because Dr. Jahangir brought this up, if you are fully vaccinated and you are carrying the vaccine from exposure, fully vaccinated people, the genetic material of the virus will not last as long if you are not unvaccinated and you're just transmitting that. So if you are fully vaccinated, you carry the virus, you are a carrier, it's not going to live on you as long as if you are unvaccinated. And that is extremely important, especially for your loved ones at home.
So
that's one of the most important things for people also to consider, to protect your loved ones, elderly or younger ones. So by getting vaccinated too.
So I think that leads to the question, and you've kind of answered it, that what are the quarantine regulations for those who are exposed, and obviously if you're vaccinated, you have a lot more ability to still go around and live your life versus if you weren't vaccinated. And but in Nashville, there's a mask mandate for indoors. So what some people might ask, like, why do we still need the mask mandate? I've been in places where people are hesitant. They feel like they're vaccinated. It's not that important, and what do you say about that?
So I will say in Nashville, actually, we don't have a mask mandate anymore. Metro buildings has a mask mandate.
Yeah.
Metro schools has, and lots of businesses have that, which I welcome. Here's the thing. Can I even step back and talk a little bit more formally about the quarantining and the self-isolation stuff? So if you are unvaccinated and you are exposed to someone for more than 15 minutes who's test positive, you have to self-isolate for 14 days or quarantine for 14 days, or excuse me, 10 days. I misspoke, 10 days without a test, and 7 days if you get a test on day 5 and you're asymptomatic, okay? So you have not received the vaccine, you're exposed to someone, you need to pull yourself out of society for a minimum of 7 days or 10 days, assuming you don't develop symptoms, okay? If you are vaccinated and you're exposed to someone, you need to wear a mask. That's the recommendation, but you can go around the world, maybe test at day 5, assuming you're asymptomatic, okay? Now, the thought around why one should wear a mask indoors is exactly what we kind of started talking about. You're minimizing spread from you, as well as minimizing spread received from others, especially in places that are not as ventilated. So we just talked about, that we literally have someone here who got a vaccine 6 months ago, who I'm sure has followed, protocols as best as possible, and he still got sick, right? So like breakthrough cases are possible, and so that's why it's important to protect yourself as much as possible. Again, thank God he and his family didn't get as sick because they were vaccinated. I really fundamentally believe that is an accurate statement. But I think that's why wearing masks indoors. And for me, the other reason, and this is my personal choice, is I model it for my children. Like, so if I go somewhere, my kids, like, I don't think it's necessarily, I think it's good best practice, but I don't think it's right if they're wearing a mask and I'm like, oh, look at me, I can wear. It's just so, that's another personal reason I choose to wear a mask. So we can model the what I believe is good behavior for our children.
Correct me if I'm wrong, Alex, also, because this is very important for our audience. Especially, we have a lot of the mosques leadership in the meetings, and I can see Brother Kamel here has been asking us to make recommendations for the mosque, and even the CDC, I think, with the Delta variant, changed their recommendations for indoor masking, even for fully vaccinated ones with the new Delta variant, saying that in the till July or before July, if you're fully vaccinated, you don't have to wear masks even in fully in indoor areas. And except, unfortunately, now with the Delta variant, they said if you are in indoor with areas with high risk of exposure, like what happened at our mosque, for example, Friday prayers, we have a lot of people there. So it is definitely better to have mask. You have your mask on, even if you are fully vaccinated. And
yeah, that is right.
It's very important for our mosques to understand that when we tell them please put the mask on, whether you're vaccinated or not, this is a higher risk area.
I think that's right. And you know what, I think I've had the opportunity to visit Mr. Harami, and I saw kind of what some of the stuff that were done at the mosques too. I mean, the great thing is the distancing, being able, I mean, there's some great best practices that can allow you to continue to worship safely together. And I think wearing masks is just another layer on that, in addition to the distancing and the fact that, I mean, maybe minimizing some of the other socialization that happens around. But I think wearing masks is a great next step. There's this analogy I'm sure many people have heard from in different parts, but the whole Swiss cheese thing, where if you line up everything just wrong, you'll get infection. But if you just do one thing, just move it a little bit, then you're going to minimize risk of infections. And the Swiss cheese model for this is a really important one.
So I mean, I think that's important to remember, that to have a little patience. Like, this is not, hopefully, God willing, it's not going to last forever, and the restrictions that we have to live with are temporary, but it's for the good of our community that we take these preventive and safety measures. There was a question on Facebook about I think the antibody infusion. If you can address that.
Yeah. The monoclonal antibodies are really it's a game changer. It has been a game changer. It's not new anymore. Still under emergency use authorization, like the Moderna and the Johnson & Johnson vaccine. So it is still, but what it is essentially antibodies taken from people who turned positive, and you have to go to the hospital or go to, not to the hospital, but a clinic and get an infusion for 3 hours. And it really has been shown to increase the risk, increase your probability of not going to the hospital, and definitely increase your probability of surviving. Here's how it happens. If you get a test that's positive and within 10 days, the health systems around the city here, and I suspect other parts of the state are like this as well, contact your healthcare provider and they will get you into the system. So if you're again, I work at Vanderbilt, so if you're a Vanderbilt patient, or if you got your test at Vanderbilt, it would automatically like get put in the system, and then you get an appointment and you go and get your infusion. So it's super important. Another reason important to get tested, especially if you're higher risk. There are certain criteria. So I believe you have to be over 40. There's other medical risk factors. I don't know them off the top of my head. But it is an important thing. Another step to keep you from going to the hospital and dying. Better step, get vaccinated. Sorry, I have to throw that plug in there. But it's super important to monoclonal antibodies are really critical. So I appreciate you bringing that up. Yeah.
And I mean, that goes back to the point on why you should get tested, because you said there's like, you're within that 10-day window of testing positive. So if you never tested positive and then however many days out you were exposed and you get really sick, if it's too far out, you can't even start this treatment.
That's right. So very important, and I'm glad that was brought up.
Yeah, and I think with testing, and I've heard community members, we got sick, our family got sick, but nobody got tested, and it's sometimes I think that's a good reason to make sure people are getting tested. That first of all, you don't want to spread it. Second of all, you want to get the best treatment if you do start getting worse. There was another question. Somebody wants to travel to Canada. Is traveling safe? Is it safe going to Canada? Is it safe going overseas? I mean, we have a lot of community members home, wanting to visit family back home. Like,
if you ask me on personal experience, I'm gonna tell you, don't do that. Of course, it depends on the country you're visiting, and even the CDC has a place on their website when we can check which country you're going to, whether it's safe or not. Honestly, with the spread, domestic flying is still there. I know that mask is mandated even on the flight. I would say unless it is really necessary nowadays, that's my personal opinion. Unless it is really absolutely necessary that you need to travel, I would not travel for the time being unless I have to.
Yeah, and there's I think the CDC has a list of essentially no-go places, like don't go to these countries. And I think with Canada, if I'm not mistaken, I don't think you can do non-business travel to Canada as an American right now. I could be mistaken there, but I don't think I am wrong about that. And interestingly enough, I saw Justin Trudeau, the Prime Minister of Canada. I think they're going to mandate vaccines for anyone flying in Canada, effective very soon, and fly and train. So it's really interesting, just north of the border. And I think it's important to look into it. A lot of people don't want Americans right now in people from America in their country. I mean, because we're so, sometimes it's interesting seeing it that way, right? So but yeah.
And there's another question. Are we ever going to have the vaccine be mandatory, especially now that the FDA started, they gave full approval?
Yeah, I don't. So that's a very broad question. So I don't think I know the city government, I can speak only to city government, isn't going to require it for its citizens, right? Or its residents. I suspect the state won't either, just knowing what I know about the state. But businesses can, right? So as a business owner, you probably have a right to do that.
Institutions, hospitals, the same thing also.
Say that again.
They're saying that there's some institutions like Vanderbilt, our institution, and other hospitals in town, they require now, they mandate vaccine, obviously.
Yeah, and then So there you may, I suspect you'll see more like colleges, several colleges in town are requiring it. So I suspect more and more you'll see businesses require it. I have to advise you to speak to your HR professional, if there's ever there's a thoughtful process one should go through. But if for me, I feel safer knowing if I go to a business where everyone's vaccinated or required. There's a lot of concert venues now and other type places that are requiring it for patrons. It's a really interesting business decision. But there's a need for that, right? So I think it's going to be more on the individual level of a business rather than statewide or citywide or federal wide mandate.
Yeah, well, we hope as more businesses kind of adopt that kind of policy, or schools and universities, that it would really increase the vaccination rate across the board.
Can I bring two questions that Sabina you were asking before, not on the chat, because it's very important for our sisters here, because I know that this question happens very frequently, and correct me if I'm wrong, Dr. Jahangir, there. Can you get vaccinated if you are pregnant or about to get pregnant, or you're nursing? And the answer is yes, please do, actually. Because, may God forbid you get COVID and you're pregnant, you get sicker than the non-pregnant one.
Yeah, and there's been several cases of stillbirth babies recently, which really breaks my heart. And the College of OBGYNs, the fertility people, that's another thing, is fertility, right?
Yeah.
Women that want to get pregnant, and even men. I mean, there's some people have now spun that even men can become infertile. None of that's proven to be true. So I'm so glad you brought that up. And you're passing your antibodies, you're breastfeeding to your baby, right? So you're protecting your very young child as well, which is, I think, really
even as pregnant also you pass the antibodies.
Yes, that's right.
So it's very important.
So there's another level of protection.
The other question that some people that's enthusiastic, which makes me happy when they ask that question, saying, if I had COVID, do I get vaccine, or shall I get vaccine or not? And the answer would be also yes, because the immunity that you can develop from having COVID might not last you for more than 3 months, but from vaccine, it lasts more than this. And if you had, it's like somebody like me, you are fully vaccinated and you had COVID, would you get the 3rd dose or the booster dose? I would say yes to, for that too. The question is, do you get it after 90 days or do you get it right away? It depends on the immunology physician that would answer that question for you. Some would say, wait for 90 days. Some immunologists said that it can potentiate more effect, but some other people say you don't have to wait for the 90 days. Whenever it's available for you, take it. So the answer is still yes, whether you had COVID, whether you were fully vaccinated, you're looking for the booster dose, please take it.
Yeah, absolutely. Yeah, that a lot of people been asking about that. But for the protection of our community, we want to make sure everyone's vaccinated. Dr. Abu-Halimah, in the Muslim community specifically, sometimes there's the attitude that whatever is going to happen to me is going to happen to me. God has willed it. So if I get COVID, I get COVID, but I don't want to risk taking a vaccine. And so what would your answer be?
I answered that question actually for many people, Muslims and non-Muslims too. And I keep telling them, why do you assume that you are Sayyidina Ibrahim? Why do you assume that you are Abraham? That you're going to jump in the fire and it's not going to touch you? Besides, Allah subhanahu wa ta'ala did not say that, you're going to get COVID. You don't know whether you're going to get COVID or not. If you're going to get it, how bad it's going to be or not. So let's not assume that you know what's going to happen tomorrow in ghaib. At the same time, it's deen is, our religion is very clear. Allah subhanahu wa ta'ala, Rasulullah, in our religion is very clear. You do not put yourself in your harm's way. You are entrusted in your body. So, including that when Allah created the sickness, created the medicine, and created, the things that you have to take care of so you don't get sick. No, it's not, and I don't know why people say, I'm going to get it. Well, it's a matter of Islamic education here. I think our imams needs to focus on this, to tell our Muslim brothers and sisters that they believe in this, that this is a wrong attitude. The right attitude is you take your reasons, or I would say in Arabic, khud bil asbab, you take whatever protection you have to, then if it happens, it happens. As you know, I've been doing this COVID business since March for all the masjids for the past year and a half. And a lot of people were not happy with me in a lot of massages because I was a prototype of annoying, telling them about getting masks in the masjid. I took all my precautions. I had my 2 doses vaccine. I was having all the precautions. I was following the scientific data when we put the guards down, like Dr. Jahangir saying, you know, when we get tired, but we were following also the guidelines. Still, I went overseas. I had my mask on. I was taking it down when I'm going to the beach or a swimming pool or in the restaurant. With the new Delta variant, I still got it. Taking all the precautions, even fully vaccinated. So I think it is absolutely not acceptable to say, if God meant for me to have it, then I'm going to have it. Well, you don't know. So let's not assume you know. And at the same time, with all due respect, you need to listen to the other teachings we get from our holy book and from hadith, in which you have to protect yourself.
Thank you. I think Zulfa put on the chat one of my favorite hadiths. Tie your camel first and then put your trust in God.
Exactly.
So, you know, you have to do your part. And it's not about just me as an individual, whether I'm safe. There's also one of the sayings of the Prophet is, he's not a believer whose neighbor is not safe from his harm. So, you know, if we really value and love our neighbors, we would want to see this COVID nightmare go away. And that's by doing our part. And that's whether we're getting the vaccines or masking and not just keeping us safe from it, but our families and our communities that we live in. And I, you know, I mean, this has been absolutely wonderful. Any last questions? I don't see anything else.
Before last question, Sister Sabina, because I know that you asked me to speak also about the masjids, and I know other masjids are asking the same questions, and I want to satisfy my beloved brother Kamil here also. So what was going to happen to the masjids? I would take the masjid still. I would go to the precautions we had from before. From before we got the guards down, and when I would say everybody in the masjid must get, you know, the mask on. I would encourage the massages to extensively start more, you know, campaign of educating our people, and we are ready to help about getting the vaccine, because that's the first line of treatment that you're going to protect yourself and others and your beloved one with. Keep the social distancing. Is that going to be our new normal? I hope not. But we don't know what's going to happen. Well, we got, as Dr. Jahangir was saying, Alex said in July, we were having only 400 cases in Nashville. We're happy about this, but then now 5,000. So we have a new variant. Well, we hope things will get better, but till it gets better, let's go back to our extreme precautions. I'm not saying shut the masjids down. May Allah forbid, if your masjid becomes a culprit or ground zero for a breakthrough cases, well, we would, at that point, we're going to recommend for you to shut down probably. We're not going to say it's the masjid leadership decision at the end of the day, but we don't want our mosque to be also ground zero for spreading the infection in the community. It's not the right thing to do. And from a religious perspective, it's not the right thing to do. So keep your social distances, please, in the masjids. And if you want to do screening, that's fine. But mandate mask again inside the masjid. Even if you are very vaccinated, please do that. If you have community gatherings, we in the ICM in Murfreesboro, we canceled a youth community gathering actually this weekend, although we like the youth to come to the mosque, but we had to cancel it because we were worried about the breakthrough cases. And we want to emphasize and take that as a chance to campaign with our youth the importance of getting vaccinated. How long that's going to last, I don't know yet, and nobody knows yet. But if it gets better, then we can modify our recommendations. For the time being, Be careful, protect yourself, and protect your loved ones.
Okay. No, thank you. I think Dr. Jahangir, you want to add any closing thoughts?
Yeah, inshallah, this all will be done at some point. Yes, I'm with you. But until then, I want to reiterate a couple of points because I think they're so critical. The city of Nashville and all of us who are fortunate enough to be able to help with this are going to continue to provide testing as this variant's going up. So if you go to asafenashville.org, there's a link to our vaccination events, because at the end of the day, I'd rather vaccinate you than just test you, right? We'll test you too, but we really want to vaccinate everyone, especially as hopefully children will be approved for the vaccine. Hopefully the thought is later in the fall, early winter. We want to vaccinate, and especially as I mentioned, hopefully tomorrow we'll have really clearer guidelines around the booster for those who are not immune compromised. If you are immune compromised, you may be time for your third shot now. Our city sites, as well as our medical centers and so forth, do that. Vaccines.gov, another great website to find a vaccine close to you. Our testing, so let me talk about testing one more second. Our testing site on Murfreesboro Road, we say 2492, so it said 2492, Old Kmart on Murfreesboro Road, is open 7 to 1. Over 4,000 people were tested there, and we're going to announce another one of the sites, another part of town here this week. So we're there for you, okay? And we're there for our community. I mean, 20% of people are coming from out of Nashville. Vaccines.gov will tell you where to get a vaccine anywhere in the state. And if you want answers, get vaccineanswers.org, great place. And most importantly for me is, and I know you all do this better than a lot of people, is just take care of your fellow neighbors, right? And speak to, it's okay for people to have questions and hesitancies, and let's just all talk through it together and get to that point. Me as a speaking head on TV, or even on the Zoom, maybe it's hopefully more impactful on this, isn't going to move that needle. It's what we're seeing move the needle is people talking to people they trust, who they know, who can help them get there. And so I'm grateful for this opportunity. I'm grateful for the fact that we've had many vaccine events with you, Sabina, and hopefully locations. I know we have other locations, and we at Metro Public Health are glad to do anything like that anytime. So please, if you know how to get a hold of us, we're happy to expand those. We've done over 450 pop-up events. But thank you all. And we're going to get through this. We're not letting our guard down. We're going to keep our foot on gas, and irrespective of what happens around us, we're committed to making sure we get beyond this and get our community back to where it was before March 20th or March 7th.
Thank you so much, Dr. Jahangir. I mean, you have shared a lot of valuable information, but your work as the chair of the COVID task force, I mean, you become, our member of our family, seeing you all the time. So welcome to come to any of our mosques, and we hope AMAC hopes to continue to do these vaccine events. We've had it with Nalzad online at the Saladin Center and the Islamic Center of Tennessee, just on the August 21st. And just to say, like, we had equal number of COVID testing as we had vaccination at that event. So, and we shared on the chat a lot of the websites that you mentioned, and also at the AMAC website at amactn.org, we have a page just on the vaccines and some information in different languages. So, and I think this important point to make, that this is a conversation that we have with family and friends, not an argument. And no one likes to be pushed or bullied into doing something they're not sure of doing. So it's really having the facts in hands and being respectful of each other. That's where we're going to, that's how we're going to get somewhere. So Thank you so much. And Dr. Abu-Halimah, you want to say a few parting words?
Yeah, I would like to thank Alex for coming. Really, as you mentioned, he's been becoming our hero there, you know, and our voice, obviously. So we're gonna continue to have him more and more and more, and inshallah, have him also more for educating our people, also his people, obviously. So it's very important for us, as you mentioned, that this is, we're not bullying anybody about this. You know, I was you know, unfortunately painful with people in the masjid about the mask, but again, I'm doing this because I care. Regarding the vaccine, I know it is a little bit more different, and I'm being very cautious how to talk to people about vaccine, about having a conversation about vaccine. Tell me why you're thinking that vaccine is not good. You know, why do you think that you should not take vaccine? Even if, from a religious point of view, let's just talk about this. Let's just discuss this. Is that truly in our religion that you should not be vaccinated? On what basis? So let's have this conversation, but let's keep our foot on the gas pedal, Alex was saying, because that's the only way we're going to protect ourselves and our beloved ones. And remember, we are part of a bigger society, and we should be role models, each and every one of us, of what we need to do for our society at large too. That's our duty. That's our duty as citizens and as good citizens. So may Allah protect you all. And Alex, thank you very much again for joining us. This is phenomenal. I really appreciate your help. And AMAC and Sabina and Rabzilia, thank you for getting us in this wonderful forum. And we hope to have more and more of this. The first thing happened when I got sick, I remember I was texting Sister Sabina, telling her I would like to use myself as an example to tell people, please get vaccinated so you don't, inshallah, die, not be in the hospital. So I think it's very important.
No, thank you both for joining us, and for everyone who joined us online, on Zoom, on Facebook. Thank you. I hope this has been beneficial, and this will be on our Facebook page, and we will also upload it on YouTube. You know, go to our website at amactn.org to sign up for our newsletters. We'll also share it out with our newsletters. So I want to make this information easy to share out with family and friends. So again, thank you all for joining us. Thank you, Dr. Jahangir and Dr. Abu-Halimah. And hopefully we'll see you again in better circumstances.
Inshallah.
Right.
Bye-bye.
All right.
Thank
you. Thank you.
Thank you.